Pink eye. It's one of the most common things to affect children. But what exactly is it, and does it always need to be treated? I'm Dr. Niky, I'm a board-certified pediatrician, and today we're going to talk all about pink eye, the different types of pink eye, what may need treatment and what may not need treatment. So the medical term for pink eye is conjunctivitis, and that's because it's the inflammation of the conjunctiva, which is the white part of your eye, and that's the part that you see turns pink. Hence the general term pink eye. So what causes conjunctivitis? Well, there's generally about 4 different things that can cause conjunctivitis. So one of the causes of conjunctivitis or pink eye, and probably the most common cause, are viruses. Any virus that can cause the common cold can also cause your eyes to be pink. Some viruses that are known to do this are influenza, adenovirus, but really any virus, any common cold virus can cause you to get conjunctivitis. Another common cause of conjunctivitis or pink eye is probably the one that most parents think about when they see their kids wake up with red eyes, and that is bacteria. Bacterial conjunctivitis is caused by a wide variety of bacteria out there. Some of the same bacteria that can cause throat infections or ear infections can also cause conjunctivitis or pink eye. Sometimes it's even caused by the same bacteria that cause chlamydia and gonorrhea, which are 2 really common STIs. Another common cause of conjunctivitis is allergies. Allergic conjunctivitis is exactly as it sounds. So in children who tend to have allergies, seasonal allergies, or allergies to pollen or trees or grass, tend to get allergic conjunctivitis. The 4th common cause of conjunctivitis is irritant conjunctivitis. So one common example of this is after spending the day in the pool, if you get some chlorine in your eyes, you may see that your eyes look red later that day. That's a common cause of irritant conjunctivitis. So let's get into a little bit more detail about the different symptoms that you may see with each of these different types of conjunctivitis, and which symptoms specifically should prompt you to see a healthcare provider. Okay, so let's start with the 2 different infectious causes of conjunctivitis, viral and bacterial. So both of these types of conjunctivitis are contagious because they are both caused by infections, but the viral conjunctivitis tends to resolve on its own, while the bacterial conjunctivitis needs treatment. So how do we differentiate between the 2? Well, sometimes it can be difficult, but generally there are some differences between the 2. So with viral conjunctivitis, you'll often have other viral symptoms that preceded the conjunctivitis, such as cough, congestion, runny nose, typical common cold symptoms. These often come either hand in hand or before the symptoms of conjunctivitis in a viral conjunctivitis. Also, in viral conjunctivitis, you tend to see both eyes affected, although it can be that one eye may be affected first and then the second eye is affected as well. You can see discharge from the eye with viral conjunctivitis. Usually this discharge is more thin, sometimes clear. It can be yellow in color as well, but it's usually not super thick and not keeping the eyes, shut in the morning, and tends to clear pretty easily. So cold symptoms, usually both eyes affected, some discharge, not very thick. These tend to be the symptoms of viral conjunctivitis. What is the treatment? Time. Time will make this go away. There are no medications that will treat these viruses. It just takes time for them to clear out of your system, and as they start to clear, that conjunctivitis will clear up as well. So next, let's talk about the other infectious cause of conjunctivitis, and that is bacterial conjunctivitis. As I mentioned before, there's a lot of different bacteria that can cause bacterial conjunctivitis. So what might you see with bacterial conjunctivitis? Well, oftentimes bacterial conjunctivitis can actually affect just one eye, although it does spread very easily, so if they rub one eye and touch the other eye, it can very easily spread to the other eye as well. The redness of the eyes that you see in all of these types of conjunctivitis can tend to be pretty significant in bacterial conjunctivitis and can be very bright red in color. Bacterial conjunctivitis will also definitely have discharge with it, and this tends to be more of a thick, purulent discharge, meaning it's usually yellow or green in color and tends to be very thick and crusty and difficult to open the eye, especially first thing in the morning. The discharge does not clear up very easily just by wiping it down as it would in the viral conjunctivitis, and it can tend to stick around throughout the day. Bacterial conjunctivitis does need to be treated, and it's usually treated with antibiotic eye drops or eye ointment. Now getting into allergic conjunctivitis, so this is most common in the spring or the fall. It tends to affect both eyes equally. If you already know that your child has allergies, they are at higher risk of having allergic conjunctivitis. They may have a lot of itching and even some swelling of both eyelids and the conjunctiva. They usually don't have too much discharge. They may have some tearing from the irritation, but you're not really going to see that, whitish or yellowish kind of continuous drainage. If your child is suffering from what you believe is allergic conjunctivitis, it's a good idea to talk to your doctor because there are various treatments for allergies, whether it's oral medications or treatment specifically for the eye irritation or nasal spray. There's all sorts of different treatments dependent on your child's specific symptoms. So if you think that the conjunctivitis is from allergies, it's a good idea to touch base with their doctor to see if they recommend any specific medication for their type of allergy. Finally, with irritant conjunctivitis, this also tends to be more of a mild presentation of both eyes, and there's usually some sort of known irritant beforehand. So remember, both viral and bacterial conjunctivitis are very contagious, while the other ones are not. And please remember that I am a pediatrician, but I am not your child's pediatrician. I cannot evaluate your child. This video is not medical advice, it is just a general overview of the different types of conjunctivitis and presenting you with all the various things that you might see so that you can use it sort of as a guide in making decisions on your child's health and when to contact a healthcare provider. Big reasons to reach out to your doctor would be if your child has conjunctivitis along with fever, significant pain, significant swelling around the eyelids, redness around the eyelids. If there is significant thick drainage that is difficult to clear, that is keeping the eyes stuck shut together, and anything else in your gut that makes you think that you need your child to see a doctor, please do not hesitate to reach out to them. If they evaluate your child and tell you this is viral and it will get better in a couple of days, it's better to get them evaluated if you have a concern than to sit on it for too long as it continues to get worse. I hope this was helpful. Don't forget to subscribe to my channel. I put out multiple videos every week. I hope to see you all there.